Today we are talking to Dr. Hartman and Dr. McCann. Welcome. You guys are with Allergy Partners of the Piedmont, so you help us during this crazy allergy season. Thank you.
You're welcome.
So tell us a little bit about first Allergy Partners as a whole and then how it started here in the Piedmont.
Yeah. Well, I'm with Allergy Partners here in Winston-Salem. Allergy Partners is a national practice. And I'll let Dr. McCann, who's our CEO, fill you in kind of a bit about the history and what that looks like. But we've got offices all over the country. Allergy Partners started in North Carolina. And I'm not certain if we in Winston-Salem are one of the older practices, but I think we are. We've been around a while.
Yeah, you're one of the older ones.
And so we offer patients allergy services Monday through Friday, taking care of all allergy conditions: asthma, nasal symptoms, allergic eye, allergic skin, hives, food allergy. But we're part of a bigger organization, which actually started years ago with one office in Asheville, North Carolina.
Yeah, so actually next year will be our 50th anniversary.
Wow.
So Dr. Spencer Atwater did his allergy training in the Mayo Clinic in Rochester, New York, and he grew up in Georgia and had vacationed as a child growing up in the mountains. And so when he was finishing up his training, he really wanted to come back to the mountains to establish his practice. So he came to Asheville, North Carolina, and started practice there in 1977. And then 10 years later, Dr. David Brown joined him in 1987. And a couple years after that, those who don't know Dr. Brown, he's an entrepreneur at heart. And he sort of looked at allergy and realized that it was practice of allergy is very different depending on where people trained. And so there was a lot of variation in how people practiced allergy. And he saw it as an opportunity, like, wouldn't it be great to sort of pull resources and try to standardize things and make the practice of allergy easier for the physicians, but then also standardize the treatment and improve the quality of care. So he had this idea and started Allergy Partners first with a practice in Spartanburg, South Carolina, and one in Marion, North Carolina. And at that time, the technology was the fax machine. So they started working through fax machines. And then one of the doctors who had joined early on retired. And then, like a lot of allergists, got tired of being retired. And he moved to Wilmington, North Carolina. And so he went and joined another practice down there. And about a year or two into it, his new partner was like, man, this deal with insurance companies is a pain. I don't know what to do. And he goes, well, I know these guys in Asheville. You should join them. And I think Winston came after that with Dr. McCann after that. So I think you guys were like the fourth practice. So it really started sort of a cottage industry, if you would, with practices in North Carolina, South Carolina, and then over the course of 30-some years has grown. And now we're in 20 states. We have about 140 allergists and about 50 advanced practice providers. And as Joel mentioned, we just do allergies. So our practice is specialized just to treating allergy, asthma, and related conditions. And we try to centralize things where it makes sense to centralize. One of the things that Dr. Brown did very early on was one of the key treatments we do is allergen immunotherapy, also known as allergy shots. Right? If you're allergic to cats and dogs, we make a formulation for you to desensitize you against cats and dogs. And that formulation traditionally had been done at each individual practice. And early into the history of Allergy Partners, we set up a centralized lab. So we now have a lab in Asheville that compounds every patient's specific immunotherapy. And every one of those prescriptions is tailored to that individual patient based on what they're allergic to and their history, et cetera. And all those prescriptions are fulfilled at our centralized extract facility in Asheville. And we make about 500,000 vials a year of extract. So it's the biggest extract facility in the country. But what that allows us to do is really home in on, obviously quality, standardization, making sure that the dosing is really right, because when you're doing immunotherapy, the dose really makes a huge difference. And then in turn also makes it so much more efficient for our practices. So, better patient quality outcomes, but then easier for the practices. And we do a lot of those things to sort of centralize that to make it easier and more efficient for the practices, but then also better for the patients.
Yeah. And it sounds like this kind of big organization where you could kind of get lost, right? And it's not at all.
No,
I mean, we really do. Our culture, for better or for worse sometimes, is we're very much a family, right? Yeah. And so folks who see us, or at least me here, if there's something that I don't know the answer to, or there's something I'm not familiar with, right? I have a network of allergists across the country that I can, engage and kind of run things off of, and kind of vice versa. And so we do very much have always operated, as one practice. And so even though Allergy Partners is across all these states, I mean, you really do have all of these resources and a family of doctors that really are engaged at kind of helping take care of folks.
Totally agree.
So it's been a great experience to like practice
Oh,
in
yeah.
for that reason. It's not just my local partners, but it's partners across the country. So it's been wonderful.
Yeah, we have this thing called All Doctors Email. So if you see an odd case or something you're not sure what to do, send an email, and within minutes you'll get answers from
That
people.
is a great resource.
I remember I had one patient, and it's a young man came in, had this weird, it was a drug rash, but he was taking 2 different antibiotics. And so the question was, which one was it? And one of our partners said, well, I don't know the answer, but I know this guy, and let me get in touch with him. And it was a professor in like Switzerland. And so he connected with this guy in Switzerland, and literally within a day, this professor in Switzerland emailed me and said, given the choice of 2, it's this drug, and here's why, da-da-da-da-da. And I remember calling the patient and the family back and saying, well, I talked to this professor in Switzerland, and he said, it's this drug, that's the one to avoid, the other one's okay. And she was blown away. And I was too. I was like, I can't believe this guy responded to my email. But that's the kind of networking you get as part of a bigger group, is to be able to have access to those types of things. And it's great when that makes a difference for the patients.
Yeah. So the allergy testing, is it still the same age-old process of like the 300 shots and all that stuff? Because the reason I asked that, whenever I think it was 4, and then another one when I was about 8, and another one when I was 9, and 2 of those actually included the scrape test on my back as well. And that was awful. It was I was there so many times. The doctor for that started calling me Chief because I was marked up so bad that it was like, I know it's not political correct anymore, but like I was an Indian chief. So that's why he called me that.
You've been branded.
I had been. Yeah, I was allergic to anything and everything that had fur, feathers, hair, even some humans. So yeah. Luckily, food passed me by, but everything else, dust can kill me. Mold can kill me.
Yeah.
Well, it can kill anybody, but and cats are the worst.
Yeah.
Which I love cats, but it's a real quick washing my hand. It's rub, wash my hand, rub, wash my hand.
Right, because of your symptoms with the cat.
Yeah.
So scrape sounds so traumatic. Probably
Well, it was when I was that young.
When you're 4 years old, it is it can be very traumatic.
Yeah.
So skin testing is still kind of the hallmark, the procedure that we do, and kind of the foundation of how we identify whether folks have allergies, right? So taking the history, what's happened and what your symptoms are is certainly probably the most important thing, and then testing is used to kind of help us understand exactly what is contributing to someone's symptoms. And yes, we still do skin testing. And I think that the equipment we've used has evolved a bit more in that, I see patients who were tested 20 years ago and they're like, are you still going to use all those needles? Well, there's not a whole lot of needles involved in skin testing anymore. There's small plastic kind of devices that are used to just gently kind of scratch the surface of the skin, almost as if you kind of have a little hangnail and you're scratching the back of the hand. And we can test to a lot of things if we needed to, but for young kids, we tend to do less testing that covers a broad array of allergens, so they don't have to sit with like 66 different scratch tests in the office. We have equipment that allows us to very accurately and kind of surgically hone in on 4 basic panels, so they don't have to sit with these like large panels of skin testing on their back. Now, sometimes it's necessary for us to do that. And what I tell folks is, the worst part of this isn't necessarily the test. It's that if you're allergic, you're going to itch.
Yeah.
And I let them know that if you scratch, your sibling who's sitting on the couch with you can punch you in the shoulder.
Yeah, I wasn't itchy for those, but the shot part was the worst. And the last time I went, I was 9, 1979, if we're being exact. That I did it was round 1 because they had to come back and do it again.
Yeah.
I was sitting there with my mom, and she goes, are you okay? And my face hit the table, and I sat straight back up. I'm like, yeah, I'm okay. But it was a lot.
I think
I'm not trying to dissuade anybody who might need this.
As you're describing this, there was an older technique they called endpoint titration, where they would do these serial tests of the same antigen at different strengths, and they would use a needle. And it sounds like that's probably what you experienced as a young child. We do not do that anymore.
That doesn't sound good.
So
Yeah.
most of our testing is
for changing.
Yeah. So I used to tell little kids, we call them prickles and tickles. And then, but a lot of kids, small kids in particular, they in their mind they envision it's going to be these enormous needles. And so I would frequently get one of the little prick tests out and hand it to them. I'll say, touch it, feel it, see it's not a needle. It's very, and let them go ahead and do a prick on their own skin. So that's all we're going to do. The worst part is at this point, as Joel mentioned, is the itching. That tends to be the worst part of it.
Yeah.
But not to downplay the anxiety associated.
Oh yeah, the anxiety is definitely real.
Like people get very nervous when they got to see their lawyers and their doctors, right? And sometimes they have to see them on the same day.
Sometimes you need a doctor once you've had your lawyer.
Oh, exactly. Once you get your bill from your attorney. But we do try to. First of all, it's different than it used to be. We don't use this serial kind of titration of antigens or allergens, and so it doesn't employ a lot of needles, especially with young kids. It is generally well tolerated, but we do take time to sit down and kind of show kiddos what we're doing, and we also know back what wasn't available when you were young that's available now is like YouTube and social media. So very much folks come very informed and are telling me, hey, we showed this video to our kids. They're fine with it, and we showed them that it's not bad, and they often come a bit less anxious, but we still do the same thing. We show them the testing. We tell them we're never going to do anything without you knowing. You're going to be able to tell us how you feel and whether you're anxious. And adults are like this too. There are a lot of adults who come in who are quite anxious about it. So we don't discount that, but it's a much different experience now, I think, than it was back when you were testing.
It was traumatic, if nothing else, just in my memory. It may have been that bad. The scrape test was awful. But I did get a Kisses Dynasty for free. I was going to have to use my allowance money to buy it, and my mom says, you get through this and you don't have to pay me back. So I did get that.
It's definitely not that bad. So like I was telling you, my 3 daughters, the oldest who's almost 20 and the youngest who's 2, have been to you guys a lot. And they've all 3 done the scratch test, and I just tell them, like you said, like I let them, like I run my fingernail. I'm like, it's not going to hurt any more than that, know, and it's, so I think it is the anxiety that leads up to, especially for my oldest, she has anxiety. So I think it's just the knowing you're going to do this.
The build up.
It's the fear factor.
When I go to my doctor, I'm always like, oh no, what's my blood pressure going to be today? And, I'm always, so we know that it's kind of baked into the experience, unfortunately. We're not that scary. It's we're cool people. We're cool guys.
We're warm and fuzzy.
So my son had allergy testing. Jake was, I guess, 7 or 8 when he had it. Very, very much kind of test phobic, very nervous. And I remember I let my partner do it because I was like, I'm your dad. I don't want to be the one doing your testing. So I pawned it off on one of my partners, right? But I remember Jake coming out of the room with his shirt off, flexing his muscles, walking down the hall, being like, this is nothing. I want to talk to all your patients, Dad, and tell them not to worry about it. And I'm like, Jake, you got to go back in the room there, boss.
That's hilarious.
So there is a degree of anxiety to it, but folks do very well with it.
So as far as the shots, it probably is different for each person, but what's the average span for how long they have to get these shots?
Yeah. So allergy shots, essentially what we are trying to do is retrain the immune system to go from allergic to not allergic. And we use very small amounts of what someone's allergic to, essentially, to kind of retrain their immune system to do that. And there are really 2 phases to allergy shots. There's a build-up phase, which you come in weekly, and we give you a little higher dose every time you get your injection. And it depends on kind of the protocol that you use for that build-up phase as to how long you'll spend there, months in that build-up phase. Once you get through the build-up phase, you reach kind of a dose that's called maintenance. And so that's your standard highest concentration that then you remain on for the duration of allergy shot therapy. Allergen immunotherapy is the kind of medical term for it. And that range is anywhere from 3 to 5 years total from the first time you get your shot to the end of therapy. That might be a bit longer for some people, typically adults, I think, who are allergic, and shorter if folks respond very well, typically younger folks and kids. And so the kind of standard answer would be about 3 to 5 years total on allergy
Is it
shots.
just environmental allergies that the shots are for? Can you do food allergies now?
So food allergy is a wonderful segue, but yes, for environmental allergens, allergy shots only.
Okay.
Interesting.
And
Go
bee
ahead.
venom.
And bee
venom.
venom.
And
Yeah,
so
thank
people are
you.
allergic to bees.
Yep.
Okay.
And venom. So if someone had a reaction to like a hornet or a honeybee or a fire ant, that we do allergy shots with those as well. From a food perspective, interestingly, years and years ago, the research with treating food allergies started with food injections, and it actually was not a safe procedure.
I wouldn't
And
think
so,
it would be, but I always wondered about.
Yep.
yeah, and so we no longer do that. Now there are some very early studies looking at kind of doing injectable food therapy with manipulated proteins so that they're less allergenic and have less of a risk of severe reactions. But as of right now, 2026, allergy shots are for environmentals, including venoms. And then there are other forms of immunotherapy that we do use at Allergy Partners and across the country for food. Different than shots.
I just find it interesting with the food allergies how much they change from one, even in one person. You could grow out of it, you could get a new one. Like,
Yeah.
is there much science behind that yet? Do
Is
we
that
know
like
a lot?
trading it in?
So we actually, our understanding of food allergy is expanding like exponentially. So if you were to, I mean, I don't know, Bill, you may.
You're saying I'm old, so I remember back in the day.
So in medicine, right, in allergy, you're always thinking about, if someone were to ask you the question, like, what part of your specialty is really expanding at a very rapid rate as far as your understanding, therapeutics, how you manage it, how you follow it, how you diagnose it. And I think food allergy for us is probably one of those subspecialties within allergy that's really expanding. Like, I mean, the data and the science changes. It's not just like, year to year, but sometimes month to month as far as therapeutics that are available. And we do know that the kind of prevalence of food allergies increasing, not just in kids, but adults as well. I mean, when I was in training 15, 16 years ago, when I was sitting with a patient, I mean, I would very much give them the message that this is way more common in kids than adults. But actually, when you look at the prevalence of food allergy in the United States, it's becoming kind of level between kids and adults. And your allergies certainly can change over time, and that may be food dependent. So, for instance,
I was about to say, what causes it?
yeah, and so that is a very complex question.
Yeah, sure. I get that.
Yeah.
But there is, it's probably a combination of genetics and some other environmental exposure or lack of exposure at the right time. So certainly not everybody who has a family member with food allergy themselves has food allergy, right? There are kiddos we see who both parents have allergies to foods, and none of their 5 or 6 kids have food allergy. And then the reverse is true, where all their kids have food allergy, but nobody else in the family has it, right? So we know that there's this genetic component, but it's not the entire story. We're actually trying to understand some of those factors a little bit better that lead to the development of food allergy. We know that there are certain risk factors that may increase the risk of developing food allergy. Having a first-degree family member with food allergy is one of them. Having eczema as a kid is one of them. Having one food allergy may increase your risk of having another. And probably one of the bigger risk factors for developing food allergy is not introducing it into the diet early enough. And so there's been a big push in the field of food allergy over the last several years of kind of demystifying the fear of food and really empowering parents in a very controlled way to kind of introduce foods early on in the diet. In our country, we have such a higher rate of allergy to peanut compared to other countries, and we think one of the biggest factors is in other countries, peanut protein is introduced into the diet between like 6 months and 11 months of age, versus we've historically told parents, you got to avoid it till maybe 1 or 2 years of age. And so we think that early introduction may be one of the bigger ways to reduce the risk of food allergy. That's a really long answer to that simple question. Both of those are great questions.
Yeah, I mean, so when I started out as a pediatrician, the standard teaching was you wanted to wait to introduce these highly allergenic foods till the child's gut was fully developed, 2 years, 3 years. So it was don't feed your baby peanut butter. Turns out that was the wrong answer. Best of intentions.
It's my
but that's
favorite
what it
food,
was.
so I'm so glad that I'm not allergic.
But that has fueled it, and now the teaching, obviously, the recommendations are to do the early introduction of those foods, because actually by introducing those foods to the immune system earlier, the immune system learns tolerance, and that's probably the key thing with our immune system is it's designed to do sort of two essential functions: to identify self from non-self, right? So you don't want your immune system attacking your own body, and then the other is the non-self stuff, what's harmful that it should sort of mess with, like bacteria and viruses, and what's sort of normal, run-of-the-mill stuff to ignore. And that's what we call tolerance. And what happens in people with this allergic tendency, or that genetic tendency, is their immune system, it works fine, but it's working in overdrive and reacting against substances in the environment it should ignore, be it cat dander or peanut butter, egg, milk, etc. And so it's a genetic predisposition that is very, very common. I mean, about 30% of the human population has this genetic tendency for their immune system to do that. But there are probably some very early life exposures or not exposures that makes people more prone to developing allergies. And one of those sort of early life exposures is something called the hygiene hypothesis. And what that posits is if you look at populations of people who grow up in sort of very traditional farming communities, their rate of asthma and allergy is much, much lower, even if they're genetically very similar to another population that lives in the city. The kids in the city are much more prone to developing stuff. And part of the theory is that being exposed to farm animals, dirt, dung, all those lovely things, sends a signal to the immune system at a very young age to develop more tolerance. But if you don't get that signal, then you become more allergic. So we've seen this sort of huge explosion of allergy and food allergy, particularly in my lifetime. I mean, I went to school, nobody was allergic to peanut butter. I mean, I don't remember a kid in grade school who was allergic to peanut butter.
We didn't either.
Now it's 3 and 4 kids in a classroom. And so it is likely that we're seeing this increase is because of some of these early life exposures, but the trade-off is our infant mortality is so much better, our plumbing is better, our water supply is so much cleaner, but because of the changes in lifestyle over the last 50, 75 years, that we're seeing the higher prevalence of these things. And that's where these teachings around the early introduction of the foods are trying to reverse that trend.
That's true. So going back to that, so I have a 20-year-old, a 2-year-old, and a 3-year-old. So when the 20-year-old was little, it was you avoid all the allergens. And she actually had to get ear tubes. And since she was so sick all the time, they're like, well, while she's under, we're just going to take some blood and do food testing. And then she ended up being really allergic to peanuts and tree nuts. So it's lucky she never did eat them. But then that's how I got connected first to Allergy Partners. And then,
I just can't imagine because, I'm like 2 or 3 tablespoons a day. Just straight.
Food allergy comes with so much impact on someone's quality of life, and that someone includes your family unit, right?
Yeah.
I mean, it's one of the things that we take care of, that you walk into a room and your patient isn't just the person with food allergy, right? It's their siblings, because their house is now affected by what can come into the house. It's their parents who then have to navigate things like babysitters, and school, and events and sleepovers. And, it just has such an impact on quality of life, on your relationship with your peers. I mean, just recently, any of you guys know about this, one of the leads that was buried in the NCAA tournament is, the point guard for Michigan, Elliot Godot, has food allergy. And he actually was admitted to the emergency room with anaphylaxis.
Oh, gosh.
And still played this weekend. But, I mean, there's someone in the spotlight where food allergy was kind of front and center. But it really does. It impacts the entire caregiver unit, and so it's something that really I think that it seems very minor. Oh, you just got to avoid peanut, but you don't realize the impact that it has.
But then for the
everyone.
toddlers, my pediatrician's like, well, we start introducing early. It's like, you're crazy. You want me to give her peanuts after everything I've been through?
Right. I mean,
so it's a very flip. It was hard learning the
it is
difference.
And as a parent, right? And I make this, it's not really a joke, but like to a parent who has a kid who has a food allergy, yelling peanut is very similar to yelling shark when you're in the ocean. I mean, it really does like conjure up that guttural fear, because no parent wants their kid to go through that.
She's had 2 anaphylactic reactions too, so it's like, man.
I have a friends whose daughter, they didn't know it. She was allergic to pistachios, had one, and died that day.
Yeah,
Yeah. And I mean, those stories are uncommon, but it should never happen,
Yeah.
right? I mean, those are just unfortunate stories. And there are so many things we can do now to diagnose food allergy, to educate on the signs and symptoms of food allergy. And we now have ways that we can at least manage food allergy in such that you may be able to reduce the risk of having a reaction.
Yeah.
There are therapies that we use at Allergy Partners that include things like eating small amounts of food over time, drops under the tongue that have very small doses of food protein in it. And then we only have one FDA-approved therapy for food allergy right now. It's an injectable medicine called omalizumab. But the thought is with
That's fun to say.
Xolair is the easier way to say it. Omalizumab, right.
Omalizumab.
We'll go around the table and say it 10 times in a row, see who does well with it. But, these medications for the right folks and for the right family really do significantly reduce the risk of having a reaction if you're accidentally exposed. And so not only does it help with, safety, right, but it also helps ease some of that kind of peace of mind when you're sending your kid out, or your kid out to college who has a peanut or tree nut allergy, where the last thing they're worried about on a Friday night is probably avoiding their peanuts and tree nuts. And so that's part of the expertise we offer, is sitting down and making the diagnosis, but then talking through these issues with families. Okay, well, what's important to you? What do you want to do? How is this affecting your life? Here are the therapies that are available. Maybe just avoiding it and carrying epinephrine is right for you. Maybe you're doing that right. I mean, if you just have an allergy to peanut, perhaps it's not as hard to avoid that. But if you're allergic to peanuts, tree nuts, milk, and eggs, and the number of patients who have multiple food allergies increasing significantly as well. Maybe as many as 40 to 60% of people with food allergy have multi-food allergy. I mean, that gets hard to navigate.
Can you be allergic? I'm serious with this. Can you be allergic with alcohol?
So the answer is no.
Okay.
However, when I talk to people who have symptoms with food, kind of what I start off with is, listen, you've got food-related symptoms, and it's up to us to kind of decide what the kind of mechanism for those symptoms are. Is it immune-related, and is it due to an immune reaction? And immune reactions do include allergic reactions. Sometimes they don't. There are other immune mechanisms that aren't allergy that cause food symptoms. An example of that is like celiac disease. There's also some other. Man, you have a really
It's hard to eat in our
food-averse
house.
family. That's terrible.
I send Suzy pictures, and she's like, nah, can't have it.
But then there's a whole nother category where the symptoms very clearly occur because of the food, but it's not necessarily a reaction that's driven by an immune mechanism like an allergy. It's more of a food intolerance or a food sensitivity. And alcohol is one of those things, depending on your symptom, which can cause all sorts of things. It causes dilation of the capillaries at the surface of the skin, so a lot of people flush when they drink alcohol. If you have celiac disease, you probably aren't going to drink a really hoppy beer, some of Dr. McCann's favorite things to drink on the weekend, because that may intensify your symptoms. Those symptoms, while maybe not related to an allergic mechanism, are certainly driven by food, right? But we might not understand very clearly what's driving that. Do you agree with that?
No, and I think the other point too is when you're with allergy testing, food testing for allergies. I think one of the other key things is that a positive test in and of itself doesn't mean you're allergic to it. And so there is somewhat of an art of interpreting, be it skin testing or blood testing, when you're checking people for food allergy, because a positive test, the way I always explain to my patients is if you have a positive skin test, like going to Las Vegas and saying, okay, your odds of being allergic to that food are now higher. But what we need to do is really marry it up with the history and make sure that the history and the test link together. And if they don't really link together, sometimes that's what we'll do with something called a food challenge. We'll say, you know what, your symptoms don't really match. This doesn't seem to match. We'll actually challenge you to a food, because I think there's a real value a lot of times in delabeling somebody who maybe is carrying around this fear, this anxiety that, I had a positive test that I was allergic to this food. And I've seen this through the years, people who have avoided shrimp for 30 years because they had something weird happen and they went to the emergency room and so they said, oh, well, you're allergic to shellfish. Don't ever use shellfish again. And then you kind of peel it back, and then 30 years later, you're going, yeah, no, I don't think you really were. So delabeling can also be an important function that we serve as allergists, not only navigating the people who are allergic, but maybe taking that burden, that fear, that anxiety away from people who maybe don't avoid a food that they are.
There's a whole body of literature and evidence and nuance to interpreting food allergy tests.
Yeah.
It very often, we'll explain to people, hey, your food allergy test is negative, it's positive, and that's, like Dr. McCann said, really not the way it's intended. What it really does is establish kind of a likelihood. How likely is it that if you were to eat that food, that you're going to have a reaction? And the data that supports it is nuanced to the point where we may be able to tell you, you've got a 50% chance of having symptoms if you eat it. You only have a 5% chance. And so I think that's one of the levels of expertise that we bring to the table, is really being able to look at those things and interpret them in a way that gives you more of an idea of what are the chances you really do have a food allergy.
I have another friend who says that he traditionally had an allergy to cucumbers, bananas, and watermelon. And he says, but I don't know if that's still true. I said, well, go to the emergency room, stand in the middle and go, ha, and eat something and see what happens.
Does his nose run, his eyes water, and he sneezes a lot in the fall?
I don't know. Probably.
So there's this thing called oral allergy syndrome, and that people who are allergic to certain pollens, birch pollen, which is a spring pollen, summertime grass, and then ragweed, particularly in the fall, that there are certain fruits and vegetables that if you eat them raw, there's a protein in there that looks very similar in structure. So when you eat it, your mouth kind of thinks it's an allergic reaction. It causes a localized allergic reaction in the mouth, but it doesn't cause a full-blown systemic reaction, except in potentially very rare circumstances. So when you see people who come with us with those fruits and vegetables, those types of things, a lot of times it's because they've got a significant pollen allergy. And if you desensitize them to that pollen, you may lessen the severity of those types of reactions.
Well,
It's true.
yeah, I think because he could have pickles. He just couldn't
because
have
it was cooked.
cucumbers.
If you heat it, and that's the nature of it, if it's heated, it denatures, and therefore you don't have the reaction. It sort of changes the shape of it, and you don't react.
Okay.
Yeah. I mean, to your point, we see folks who come in, they schedule their appointment. Yeah, I'm itching. I have oral tingling or itching, or even sometimes a little rash around the mouth when I eat fresh apples. And they're fine when you cook it or you peel it. And you're like, okay, well, so my next question is, what are your allergy symptoms in the spring? Because inevitably those symptoms are due to seasonal allergies. And to Dr. McCann's point, allergen immunotherapy, if you imagine it desensitizes you to spring pollens, that also has the potential to help those oral symptoms with the fruits that people have symptoms with.
Such a complex topic.
There's a lot of nuance to what we do. Yeah. I mean, I think
Which makes it fun.
Yeah.
I think sometimes, and my own kids are kind of like this. Hey, you're just an allergist, and they're funny. They don't mean anything by it. My kids are awesome, and they give me a hard time. And
We all give you a hard time.
but I know, but I think sometimes folks don't realize how nuanced all this stuff is, right? It's not simply that you have an allergy to something. It's the degree to which it impacts you. The testing in some instances could be misleading. There's a high rate of false positive testing, particularly with foods. Sometimes even a negative test doesn't necessarily mean you're not allergic, because where are the symptoms happening? They're happening in your nose. We test your skin. And so there's a lot of nuance and complexity to all these things, which is why it really does take someone who's trained in the world of allergy immunology, I think, to kind of look at these things and render at least an educated decision or opinion.
Yeah, and I think the other part, what makes the field interesting to me, is so many of these things are interconnected. So if you're an allergic person, not only are you more likely to have hay fever, you're more likely to potentially have food allergy. You're more likely to develop asthma. And all of these sort of disparate diseases, be it eczema on the skin, your lungs, your sinuses, they're all connected through the immune system. And so as immunologists and as allergists, when we're talking to a patient, we're looking at the whole patient and how it's all sort of interconnected by their immune system. And then I think the great thing about immunotherapy is it's then taking all natural things that are triggering your response and retraining your immune system utilizing all natural products to desensitize and retrain the immune system. So it's a very elegant sort of treatment for organ system that is just so vital to everything we do and affects the entire body. And that just makes it fascinating for me. And then the other part that I love about it is, we can have such a great impact on the lives of our patients, and nothing's more satisfying than that.
You guys do.
I've had
Me
kids
personally.
kids who had young man had severe disabilities. He needed a service dog. He's horribly allergic to cats and dogs. We desensitized him. I still get a Christmas card with him and his dog. So those are the types of things that it's fantastic.
Yeah. And think about, I mean, you guys just like walking in, I mean, all the people right now that are struggling with kind of seasonal allergies. So there's, and think about all the over-the-counter stuff we have, all the nose sprays, all the oral medicines, all the cough medicines. Yet hundreds upon hundreds upon hundreds of people are still out there right now having symptoms. I mean, there's this huge unmet need. And one of the most effective therapies we have is allergen immunotherapy, and we can actually fix somebody, right? Kind of like a surgeon would if they went and had surgery. Kind of.
But less painful.
Less painful. Less painful.
Please.
No anesthesia required.
It is. I mean, I think it's lost on us sometimes the impact that it has. I had the same way. Just got a picture from a family who adopted a dog. Both their kids were allergic, and now they have a dog that they sent me a picture of, a really cute little kind of golden doodle puppy.
So on a slightly easier topic, Winston-Salem, now that you both are you from here?
So background, I should have told you that. So I grew up in Raleigh. My wife's a PA. We moved to Winston-Salem when she was in PA school, I guess in 2001. And that's when I started medical school at Wake Forest. And so we've essentially been here the entire time. 1 year we spent in Charleston, South Carolina doing some training stuff, but came back. So I've been here now longer than I was anywhere else,
So
kind of in
you're
my
pretty
life.
much from Winston.
So I'm pretty much from Winston-Salem, and Bill's an Asheville guy.
Yeah, so my wife grew up in
Yeah.
Asheville, but she actually went to Salem College back in the
okay.
day. And then I actually grew up in Baltimore. Go Ravens.
No!
I had to say that. I had to say that.
We knew he was going to
I threw it anywhere. I got to throw it in somewhere. He's going to leave.
He took his headphones off.
There we go.
Great job, Dr.
Okay, you're
McCann.
welcome. But anyway, and then I did medical school at Georgetown, which is where I met my wife, and then we've lived in Asheville pretty much since then.
Oh, no.
Hold that and rub it against
A Pittsburgh
wow.
Steelers.
That's really ugly.
That's right. How many Super Bowls have you won?
2.
Oh, that's right. Yeah.
How many have you won since like 1979?
Doesn't matter. We
Doesn't
still
matter.
have
Okay.
6.
Podcast is derailed.
We've derailed.
All right.
My
so-
nephew is a Ravens fan. So
Well, there's a classy guy right there.
So what do you guys love about Winston-Salem?
I love the community. Like the people, the community has just been great. And I've been able to see it evolve like over the last like 20 years. And there are so many things to do. Having lived in different places growing up, folks are nice. They will extend a hand on the street if you need anything. And I just think there's this kind of Southern hospitality in this small town that's still community-based, that has a lot of the extras that you'd find in a larger city. It's easy to drive around. I just was in Philadelphia this weekend. That's where I was born originally. I'm not going back. But
you were born a second time?
I was born originally. Oh, that's right. Good point. Yeah. My first birth was in Philadelphia. My rebirth was when I moved to Winston-Salem. But yeah, so it's a wonderful community, and it's a community invested in the people, in its people, and there's just this charm to it that you don't see in other places.
Yeah. So I've never lived in Winston, but my wife went to college here, and actually when I first started dating her, she lived here, so I visited a couple times back then. But I'm amazed at how much it's changed. So we were driving down today. It was like the baseball stadium was great.
It is.
But Winston always has held for my wife a very special place in her heart. So all of her friends from college, she still comes down and visits regularly, goes to the reunions. A couple of her college roommates still live here. Saying earlier, where my daughter is graduating from NC State and she's ready to go to law school, and she had narrowed it down to either moving to Winston or to Chapel Hill, but I think she's going to go to.
Oh,
My wife was pulling for Winston.
I
She's
bet.
like, Wake Forest is so beautiful. She's been to Winston.
It is beautiful.
So, yeah.
Yeah, it is beautiful.
It's a better law school, too.
yeah. It is a really good law school.
I know. We'll see what she decides. We haven't signed anything yet. but
Maybe
we'll
she
see.
needs to listen to this.
Maybe she needs to listen to the podcast. Maybe she exactly. Yeah.
How can people find out about your practice and to come visit?
So probably the best 2 places would be allergypartners.com and then Facebook. So we have Allergy Partners of the Piedmont Facebook page, and we get a lot of kind of referrals through that one source. But those are probably the easiest places to find. And you can book an appointment online, and you can also get in touch with us through Facebook.
And where's
as well.
the physical location?
So we're on 1372 Westgate Center Drive, which is off of Healy Drive in Winston-Salem, only about 7 minutes from where we are now. But we have satellite offices. So not only is our mothership in Winston-Salem, that's our kind of main hub, we have office locations in Kernersville, Mount Airy, and North Wilkesboro. And so, but if folks are in, and so we'll see people from all over kind of those areas. But if you're in Winston-Salem, the main office is 1372 Westgate Center Drive.
Yeah, because Dr. Kaluzny's my eye doctor, and Dr. Raganisi's my GP.
So you're right there. We're right in the middle of that.
Yeah.
Yeah, Dr. Kaluzny's dad graduated optometry school with my dad. And so his son, who's an optometrist.
Dr. Steve. We
takes
call
care
him
of our kids.
Kaluzny the Younger.
Yeah, exactly.
That's funny.
When Big Steve was still alive, we called him Kaluzny the Elder.
When was his original birth? I'm just kidding.
Well, thank you guys for joining us.
Thank you for having us. This is great. Anytime you need someone to come in and talk about allergy, foods.
This
Ravens
could be like a
football.
multi-part.
or Steelers football.
We will. I'm
I
not
don't
coming
want to
back
put you
for
guys
that.
together.
But thank you guys for having us. We
Yes,
appreciate
thank you
it.
so
Okay.
much.
This is Twin City Talk. You can find us on Facebook and Instagram. The views and opinions portrayed by guests on this podcast are not necessarily those of the distributors and hosting companies. And if you love this podcast, that's great, but don't think about stealing it. Reach out to us and talk about the content because it is copyrighted.